It is an extreme pleasure for me this morning to be here to officiate at this campaign, a journey that I recall very well started on the 24th of April this year. Last year. Oh, last year, sorry. We are in campaigns, I had forgotten that we had crossed. This is a new year. But this is a journey that started on the 24th of April when Russia was trying to tell me about this initiative and tried to talk to me, and then we had a discussion with the First Lady as well, Mama Janet Museveni. So after this discussion, she kept propping me and telling me, when can we have this campaign? And I told her that I need to sit down with my technical staff and then we see how we can move on. It was not an easy subject because it's something that nobody has thought about, and yet we all know that it happens. Infertility is a big problem, but we have not come out to speak publicly about it. So in November last year, when we had the World Diabetes celebrations, of course, Merck was here to give us that support. They have been having these campaigns in the country. So we were together in Mityana, and she traveled in my car together with the Chief Executive Officer. And we had another long chat about this matter. So she said, can we do it before the elections? I said, okay, fix the date, but let it not be close to 18th. And today I'm happy that we are here as Ministry of Health to partner with Merck to promote this initiative, the More Than a Mother campaign in Uganda. Ladies and gentlemen, this initiative, as you have all heard, will address the key challenges that are associated with resource-constrained settings in prevention of infertility, education, and self-development. The IVF regulation that we have heard about is key and an important aspect. The geographic barriers, reproductive rights, and of course, limited resources that are usually our challenge in most developing countries. This program will not only provide medical education and awareness for medical students and healthcare providers, but it will also support governments to define policies to improve access to safe and effective fertility care and address the need for interventions to reduce stigmatization and social suffering of infertile women, and also raise awareness about male infertility and the necessity for a team approach to family building among couples. And I want to really thank Seruga and his wife. They have actually given us a clear example of what it means for couples to actually find a lasting solution to their problem, other than resorting to the blame game that we all know happens in most of our communities. As you have all heard, when a woman fails to give birth, then she is the problem. And yet we also know that the man can actually have the problem and may not be the woman's problem. So, ladies and gentlemen, according to the World Health Organization, more than 180 million couples in developing countries, that is 1 in every 4 couples, suffer from primary or secondary infertility. In sub-Saharan Africa, as you have heard from the previous presenters, infertility is mainly caused by infections in over 85% of women, compared to 33% worldwide, which emphasizes the importance of prevention programs in Africa. The social stigma of childlessness, especially for the infertile women, leads to isolation and stigmatization in many cultures. It's very important to take into consideration that accessible infertility treatment can only be successfully introduced in developing countries if the social, cultural, economic essentials and the needed skills are fulfilled by our governments, and also the political support, which is very, very important. I'm glad when I see the 2 powerful women from Parliament, together with the other members of Parliament here, the male member of Parliament, who is, I believe, representing the other male members of Parliament, then for us, the political will is already there. I want to pledge my full commitment to this initiative, and I will pledge right now that I will champion this cause in Uganda. Our partnership with Merck for this historic campaign is essential to make a difference and raise awareness about the infertility prevention and the management. We should, ladies and gentlemen, respect women, whether they are mothers or not. Rather than stigmatize them, we need to empower them socially and give them better access to information so that that information can help them to manage their conditions wherever they may be. And this, of course, is very important for us in our African settings because the consequences of infertility are much more dramatic in developing countries and can create worldwide ranging social and cultural problems compared to infertility in Western societies, especially for the women. And of course, the drama, when you watch the Nigerian films, you can really see the drama that surrounds this infertility that we are talking about. I once received a phone call from one of a journalist, and she asked me that if you're a surrogate mother yourself, at the end of the day, once the child has been born, whose child is it? Whose child is it? Because there is usually a drama, even when somebody has hired your womb, then you want to own the child. That child is not yours. This is what I told the journalist. If you keep money in the bank, does that money belong to the bank? It's yours. That was my answer. And of course, it's very unfortunate that Honorable Joyce had to go through all that long process. I call it a drama because actually the child is yours. So, ladies and gentlemen, we have also had drama. When you look at all these child thefts going on, babies being stolen in hospitals every other day, it's all because of the stigma. You know, you can't settle in a marriage. The man is demanding for the child. The sisters and brothers are demanding for a child. What are you doing? Simply eating our son's food and going to the toilet? They want a child. So at the end of it all, this forces some women to go and, live away from home for some 9 months, steal a baby, and then return and claim this child is theirs. And there's more drama when later you find that this child has grown up but resembles another child somewhere. I hope all of you were following that story, the most recent story in the media about a woman who lost her baby in the hospital. But in her, she believed that they gave her a dead child, a dead baby. She didn't believe that was her baby. She went, told her husband, they buried the kid, but inside her, she believed that was not her child. But later on, because there was another child who was going to school, and the other child came back with the friend, but the two look alike. And the next thing was this mother decided to go and follow this child at school, and the parents of the other kid were asked to go. And of course, I think the matter is now being handled by police, because now the two children, and the other one was insisting, these are our ears. That is their trademark. These are our ears. So that is the drama. So ladies and gentlemen, a central difficulty associated with infertility is that it can transform from an acute private distress into a harsh public stigma with complex and devastating consequences. And of course, Russia has already told us about cases of diabetes. We've seen people getting pressure. and some even committing suicide because of this stigma. Psychological and physical violence also take place, and of course, the worst bit, of course, is sometimes even divorce. So, ladies and gentlemen, in most of our countries, childless women still suffer discrimination, stigma, and ostracism. So I'm quite confident that through the More Than a Mother initiative, together with Merck, all of us seated here as policymakers, as the academia, as fertility experts, the community, and the media will change the perception about infertile women and consider them as worthy people in society, people who can make a contribution to the development of our countries and our communities as a whole. And it's only when we do this that we can achieve a systematic shift in the current culture of gender discrimination in the context of fertility care in African societies. I also truly believe, ladies and gentlemen, in what has been stated by the UN Universal Declaration of Human Rights, that access to adequate, comprehensive reproductive health services, including infertility care, is a basic human right, regardless of the economic circumstances in which individuals are born in. Therefore, the Merck More Than a Mother campaign being launched today will contribute to identifying and implementing strategies to improve access to effective, safe, and regulated fertility care, not only in Uganda, but Africa as a whole. The level of infertility care we are aiming at addressing differs from country to country. Many variables are important, such as the economic and political situation of the country, the level of education and reproductive health care, the provision of quality medical care, the availability, of course, of the facilities to perform surgery in case of complications, and the level of care to our mothers. Fortunately, in Uganda, we have facilities up to sub-county level where some of the causes of infertility can actually be treated. You are aware that the sexually transmitted infections are actually some of the causes of infertility, and this can be addressed at most of our health center threes if people can only open up and not sit back with these infections. You heard the story of that lady, very sad. Maybe if she had gone a little earlier, the situation would have been different. So improved reproductive health education programs have proven to be an excellent preventive tool against not only promoting health in families, but also reducing on cases of infertility. So ladies and gentlemen, we of course as the Ministry of Health will do everything possible to ensure that we promote not only, we've been talking about reproductive health and focusing more on contraceptive use without looking at this other side, the causes of infertility. So I hope from now on, we are going to change our programs to make them more integrated, holistic, so that it addresses all these challenges that we're talking about today. Prevention programs, ladies and gentlemen, are more cost-effective and will benefit a greater number of people. You heard Honorable Betty Amongin talking about the insurance providers who have been excluding the treatment of infertility as some of those that they can cover through the insurance because the cost is actually so high. So if we focus on prevention, we'll be able to avert most of these cases of infertility. Therefore, the political statements and commitments need to result in appropriate actions, as said by the MC earlier. Accessible infertility care can only be provided if there is a political will to support actions for gender equality and women's empowerment through education. The universal access to safe, equitable, and effective fertility technology will require well-organized education and training programs, and I really want to thank Merck for coming up, pledging to give us support for an initial 1 year. So most importantly, ladies and gentlemen, raising public awareness about infertility in general and the male infertility specifically is another very important issue that should be done with great care. I know we are going to have all kinds of, debates around this subject, but I think it's important for men to know that for us to succeed and resolve this challenge, they should also open up. It should not only be the women. So we should, ladies and gentlemen, all be ambassadors of changing the existing moral and social cultural beliefs so that infertile women are no longer isolated and discriminated. So we'll need the media, all the other organizations, the NGOs, the religious leaders, and the politicians if we are to achieve this goal. Therefore, awareness about infertility in general and male infertility in particular should be part of an integrated reproductive care program, including family planning and contraceptive use, mother care and reproductive health education, and of course, women's education. So ladies and gentlemen, as I conclude, although male factors contribute to about half of all cases of infertility, women are overwhelmingly perceived as being the party responsible for the couple's infertility, as I had indicated later. And subsequently, the suffering associated with infertility tends to be greater for them than that of their husbands, and we must really stop this. Fertility, as you heard earlier, is a shared responsibility, and this campaign certainly will contribute to raising awareness about male infertility and encourage men to acknowledge and openly discuss their infertility issues and strive for a team approach to family building, as I indicated earlier, with their partners in order to progress towards shared fertility responsibility amongst couples. As Ministry of Health, we want to pledge our support by ensuring that we have an integrated approach to fertility care, infertility care, have proper referral systems, conduct community awareness programs about causes of infertility, and also how to prevent them. So it's now my pleasure, ladies and gentlemen, to officially launch the Merck More Than a Mother campaign in Uganda.